First of all, thank you for coming to this webinar where I'm going to be looking at the accessibility and inclusion in reports and the data that you need to know in order for this work to be meaningful. So I'd just like to start with an introduction to myself, and some of you know me. So my name's Kathy and I own Memo, and we provide proofreading and training and support around medical legal report writing and document creation. I've been proofreading for case managers for 5 years now, and what started out as a favour to a friend has built through recommendations, referrals and hard work to be a business serving the companies and networks that you can see on that slide, and a few more that I need to put on there as well. I see a lot of medico legal reports every week, and I feel like that gives me a unique overview in terms of the trends and patterns across the sector. In addition to this, I am a specialist English teacher, which means I'm combining my knowledge of medico legal report writing with my teaching expertise and providing training and support around report writing, and in particular, my passion project, which is accessibility. So today, I would like to go through the data around reading in the UK as it pertains to adults, and we'll cover what you can see on the slides. So we're going to go through the difference between reading ability and reading ages, factors which affect reading ability, what the data tells us about how many readers need documents to be made more accessible or would benefit from changes to documents, and how many of your readers need their documents changing or adapting. And then finally, how I can help with that. So we're going to look at the factors, and then we're going to have a look at and the data, and then what we can extrapolate from that. Okay, so I'm going to have my teacher hat on for a little bit, because when we talk about reading ages, this is a school-based measure, and we're looking at where the average of a child at that age should be to read comfortably, as dictated by the government. If we're meeting our developmental milestones, where should they be? Where is the bulk of the children in that age bracket where they should be to fully, and that's the important bit, fully understand the complexity of texts at that level? Now, so this graphic is just there to kind of prove that. I think it's a standard deviation. I can't remember now. My A-level maths is not coming back to me. But the bulk of people, the average, where they should be. Obviously, we have people tailing off to the lower end and people going off to the higher end. But most people, most children in that bracket should be around here. And why this is useful for working with adults is because it gives us a really quick tool and measure, so that for our quick comprehension of where, a quick reference of the comprehension skills of adults. So when we're creating our own texts and documents, and you're going to see some of the government guidance literally tells you the age range to make it appropriate for, it gives us a quick snapshot. Now, if we've not been in the school system recently, or we haven't got children in the school system, this I thought was just a useful graphic to go through it. Because if you're not in contact with the school system, it's easy to forget. Once you come out the other end, you forget these things. So as it stands at the moment, we start at about 4 years old, where we enter reception. We go through primary school and we leave at 11, start secondary school at 11, finish our GCSEs at 16, where you can continue into sixth form or apprenticeships or anything like that. And then between 16 and 18, and then after that, maybe onto university or qualification in the world of work. So this is sort of the overview of it. So when we look at the average reading age for an adult in this country, it is shockingly around here, between 9 to 11 years old, depending on the data source. What this means is that the average adult in the UK can have difficulties with understanding labels on prepackaged food and or understanding household bills. So if you think in terms of how much that's holding people back from being able to be active participants in their lives, making informed choices, it actually has quite significant consequences. And this is really shocking. And it's seemingly a very damning indictment of our education system, because how can we have all these people going through this education system and coming out as if they've never left primary school by the end of it? But there is a little bit more to it than just that. What you need to know is that reading ages are not static. You do not learn to read at 4 and then never go back there, and then learn to read at 5 and step up and step up and step up and keep going. Reading ages are fluid and they can change, and they do change. And we know this, and this is why we have success of things like reading schemes in schools. The frequency with which you read and the complexity of the text that you read have a direct impact on your reading age. They can push it up, but as all teachers know, they can push it down. So it is not uncommon for a child. So this, say I've circled this one, a year 8 child, by the end of year 8, they may be in line with their chronological age in terms of their reading age. But when it comes to then they leave in July, spend 6 weeks doing nothing, reading wise, as Peter Kay famously joked about, going back to school and not being able to write after 6 weeks holidays. The same is true for reading. So we can assess that same child, they leave us at year 8, come back into year 9, so where they should be 13 to 14 years old in terms of reading age, at the beginning of year 9, and they have gone back years because they haven't read anything over the summer holidays. And that's hence why we do things like reading schemes and read for 10 minutes every day. And you might have to start, if you've got children at school, you'd be familiar with this. They're saying read every day, read during the holidays, you get a stamp, you get a certificate at the end of it, get your parents to sign, because it is scary how quickly they do lose it. So what is the relevance of that for adults? Well, the relevance is that it is reported that the National Office of Statistics say that over half of UK adults do not read regularly. And so what that means is, so 1 in 2 do not read regularly. This means that their reading age is not what it was when they left education. If they are not reading regularly, their reading age has gone down. And so what that means, and obviously as well, is that they're bringing down that average. In terms of reading age as well, just to add to this problem, at the other end of the scale, there was a study completed, and I've got all the references for all the data that I'm pulling from that I can give you at the end as well. There was a study completed on healthy older adults and their reading abilities over time, which concluded an age-related decline, that as people got older, even with no health conditions whatsoever, their reading ability from 58 onwards declined. So reading ages are a really useful tool to help us to figure out where our readers are, and to, if we view it as a continuum that needs to be kept working at, and the different factors that are going to impact people as they go through. So if you remember, it isn't just about the frequency with which people read that affects the reading age. It's also the complexity of the texts. So, for example, a bugbear of mine is I would have high school students who have just continued to read Diary of a Wimpy Kid. Nothing against that book, but its reading age is about 9 or 10, and they're still reading that in year 9, and they're not moving on. The complexity of the text is not moving on. So even if they are reading every day, if the complexity isn't getting harder, if the complexity isn't the right level, they are not progressing. Their reading age is not going up. So if we're saying, okay, half of UK adults are not reading regularly, what about the half who are? And I just want to take the example of newspapers. If the main for this, if the main source of reading is a newspaper, in particularly for this, a tabloid, so the Sun, People, Mirror, use the world, that's a bit out of date, isn't it? It doesn't exist anymore. But the average reading age of a tabloid newspaper is between 7 and 11. It's actually a bit it's usually around 7 or 8. We have reading tools that we can measure the reading age. And you can just see it from those headlines: single words, simple sentences, short text broken up. And so, yes, you may be an adult and you may have gone through school, but if you're the only thing you're reading regularly, and you're reading regularly, but the only thing you're reading regularly is a tabloid newspaper, your reading age is going to be moving down towards that end of the scale. So you might say, well, it's okay, I read broadsheet newspapers every day. Well, they're not actually that much better. The average reading age of a broadsheet newspaper is about 16. So in terms of complexity, we may have more complex ideas, but in terms of the actual readability statistics, that's where we're coming out at. And these are actually decreasing in the online versions as well. So the Guardian, it's a very different experience, and you'll know this, it's a very different experience reading the Guardian newspaper physically and reading it online. And it feels different. And that's to do with how the texts are broken up, the use of images, links, videos that help to lower the reading age. So the government on their website, in terms of what they advise their departments be putting out, say that anything public facing, so any website public facing from the government, needs to be a reading age of 9. Which, if you've tried to access any of their tax, the HMRC stuff, the tax stuff made me laugh, because I'm like, no way, that's 9. It's very complex. But this is what they say. They say any website, any public-facing document needs to be accessible for a reading age of around 9 years old. And this is why. Okay. So in terms of reading ages, this is what we know. They decline with age. 1 in 2 adults don't regularly read, which will also push down reading ages. So they may leave school with a reading age of 17, but if they are not regularly reading as an adult, that goes backwards and they will go down. Around 16% of adults in England and Northern Ireland score at the lowest level of proficiency in literacy. 16%, that's huge. And the average reading age is 9 to 11. So some quite shocking statistics here, and things that we definitely need to bear in mind when we are creating public-facing documents and texts. So then what about reading ability? Reading ability is different from reading ages. It's the things that get in the way and the barriers that we may have to how well we can read, how fluent we can read, and how completely we can understand a text. So we'll all know this. So we've got health things: when we're in pain, when we're tired, sleep deprived, got a banging headache, we know we don't read as well. With maybe visual impairments, which means physically seeing what is on the page, on the screen, is difficult. That can affect our ability to read. There may be learning disabilities. Around 10% of the UK population has dyslexia alone. So that doesn't include any of the other learning or reading disabilities that people can have, and 10% is huge. And then also the base knowledge of a specific area. You can be in perfect health, have no visual impairments, have no learning disabilities, have gone through the education system all the way to the end, be regularly reading texts. But if you do not have a base knowledge of a specific area and it is not made clear, you are not going to be able, you're not going to have the reading ability to be able to read and fully understand. So I want to run a little experiment with you about base knowledge. So the following is a genuine example from, obviously as a fashionista, Vogue magazine. I have copied and pasted it exactly as it is, apart from the font, which I changed to make dyslexia friendly, in terms of it was just in a plain block of paragraph text like this. And I want you to have a look at it. And I want you to pay attention to how you feel as you are reading this text. I'll also help by reading it out. So, counterintuitively, one of the ways that designers are undermining the idea of an algorithmically flattened culture is through garments that embrace the idea of flatness physically through construction, splicing, see undercover, or suspension, see Balenciaga and Victoria Beckham. In doing so, they continue in the tradition of Martin Margiela, who once told Vogue, "When I recut clothes old on you, it's to transform them, not destroy them." This idea of building up from and expanding on what exists is one that fashion needs to embrace. Here, Vogue breaks down the key autumn-winter 2024 fashion trends to know for the new season. This is an incredibly complex piece of text, which I found shocking to read in Vogue magazine. I'm not really sure what the editors were thinking in letting this through. If we think about what happens to us physically and emotionally as we read, and I'm making an assumption that you all had the same reaction that I did to this, which was a resounding, not quite sure what this is getting at. Now, this is a reading age of 18 and an education level of an undergraduate when we run it through the tools that can measure these things. I am both those things. I'm over 18, quite substantially now, and I am postgraduate educated. And I still found this hard to read. And that wasn't to do with my reading age. It wasn't to do with my education. It's to do with my base knowledge. Now, I, every now and again, obviously don't mind reading a bit of Vogue and I want to see what the latest trends are. But this had me stumped in places. So when I read this, and I have several times, the more I've read it now, the more I do understand it. And so going back and looking and studying is fine, but for a lot of what we're writing, it needs to be a one read and understood. So I've highlighted the sections where I call them in teaching my boing moments, when you come across a word or a phrase and you don't know, and it stops you flowing because you think, I don't know what you're on about. And it can have an emotional reaction as well. You can start getting angry with the person who's created the text. You certainly disengage from it. And sometimes you can turn that inwards and blame yourself. Why don't I know this? So I've highlighted the words and the sections. I have no idea what they're talking about. Now, what I can do is have an educated guess about what they mean. And probably, if you pushed me, I could blag an understanding. But it wouldn't take close scrutiny. It wouldn't take a lot of questioning from you to uncover the fact that I don't really understand this completely. And my understanding is certainly not clear. And so when you think about your reports and you are not the knowledge that you are assuming your readers to have, when they don't know, they guess. And we can usually get by on that. But when you're writing accurate reports and things that are going to court and things that are really important, you do not want people guessing what you are getting at in a medico-legal document. There's so many quick wins here. Adding in definitions afterwards, adding in context, layering the information, which doesn't mean you have to change this. It's that you change the way that people are accessing it. Pictures would help, weren't there? Okay. So what does all this mean, Kathy? Well, what it means is the probability of an UK adult with having a reading need, so not reading regularly, being illiterate, having an average reading age of 9 to 11, having some form of reading disability, being neurodivergent, which I didn't touch on, but that's 15% of the population, or having a visual impairment, all those things mean, when you add them up, that approximately 70 to 80% of adults in the UK would benefit from adaptations for readability, accessibility, and comprehension. I also want to just mention the other things that I haven't included in this. I haven't included EAL, so English is an additional language. I haven't included contextual factors as well. So whether the place and time people are reading these reports, a busy office, for example, with lots of distractions. The other thing to note is, this is the same as the pie chart, but in a bar chart, is that you don't just belong to one of these groups. You can you can just belong to one, but we all kind of exist in various planes. Well, we can also be educated to A levels and have dyslexia and possibly be neurodivergent. And interestingly, that raises the probability of a need. So 70% has a reading age minimum. So we need to be acknowledging that in what we are creating. What this means for your documents is anything public facing needs to be bearing this in mind. Websites, social media posts, consent forms. The government guidance is that any public facing webpage, like I said, needs to have a reading age of around 9. And furthermore, it actually goes into it and it says the more complex the information, the simpler it needs to be. So what about other reports that you are writing for other professionals where you know the education level, which is for the vast majority of these? How many of those people, what's the probability of that audience having some sort of reading age need? So the probability of a reading need post GCSE educated, still 50% possibly are not reading regularly. We've got around 10% still with some sort of disability in terms of a reading need like dyslexia, 15% neurodivergent, and 4% have some sort of visual impairment. Again, note the things I've not included, EAL context. So that works out at around 25% of those level 4 educated, so GCSE and higher and above, who would benefit from adaptations for readability, accessibility, and comprehension. So this is not insignificant. So how I can help. Between being a teacher and being in this medico-legal world, I'm used to adapting my lessons for various learning needs, and I'm used to looking at text in a lot of detail. So one of the things I can do is I can help create documents which support accessibility. I can help create your style guide, which embeds good practice around accessibility, the fonts to use, the spacing to use, the phrasing to use, the templates to use, the colors to use, what to avoid. I also provide accessibility audits for companies so work I've done in the past is, for example, looking at consent documents, looking at the reading age of those, looking at how we can help bring the reading age down and make them simpler while still performing what you need those documents to do. And then finally, I am running a series, so starting in December and then running every 2 months, a series of online courses where I go through, not just, I've given you all the data in this webinar, I give you here's what we can do. Here's what we can change about how your reports are written, how your templates are created to make your reports accessible and inclusive as much as possible without knowing individual needs. So that's it from me today. I have got a list of all the references that I used, and I'm really happy to share that with anybody who would like it. If you would like to know more about the course, then you can follow me on LinkedIn, and all the details are on my page on Eventbrite, which I'll send out afterwards. I'll send this PowerPoint out as well if you would like to use it and share it with colleagues, and also make the recording available for you. So thank you so much for joining me today. I hope you found it useful. I hope you found it eye-opening. There's a lot of data there, but there is, like I said, a lot we can do to make sure that we're including everybody in our documents. Right, I'll leave you all to go and have your lunch then. Thank you so much for coming today.